Hello, welcome back to CCHP's recorded videos during COVID-19 on telehealth policy. My name is May Kwong, the Executive Director at the Center for Connected Health Policy, and today I'll be talking about not necessarily current policy issues, but what to expect after COVID-19. A few disclaimers, please. Any information provided today is strictly for informational purposes. CCHP always recommends that if you are seeking out a formal legal opinion, that you seek out legal counsel. And also, if I happen to mention some type of company or show some type of equipment, know that neither I nor CCHP has any type of financial relationship or arrangement with such a company. The Center for Connected Health Policy was established in 2009 as a program underneath the Public Health Institute. We were first established as the California Telehealth Policy Organization, but an opportunity to become the federally designated National Telehealth Policy Research Center became available through a grant from HRSA in 2012. We applied for that and we've been serving in that capacity ever since. We also do work with a variety of other partners on more specific connected health for telehealth projects, and that's a listing of some of the partners that we work with. Some of the projects that CCHP does do are a 50-state telehealth policy report on all of the state Medicaid policies, laws, and regulations related to telehealth. We also are the administrator for the National Consortium of Telehealth Resource Centers, which I'll explain in a moment. And we act as a convener for the California Telehealth Policy Coalition, which is a coalition of over 70 statewide groups that are interested in advancing telehealth policy in the state of California. The National Consortium of Telehealth Resource Centers are made up of the 14 telehealth resource centers who all get federal funding to provide technical assistance for people who have questions regarding telehealth. There are 12 regional resource centers that cover specific states and 2 national centers. CCHP is the one that covers policy, and there is another one based out of Alaska that covers technology. The regional resource centers I like to call the front line of your telehealth questions. So if you have a telehealth program that you want to refine, or if you are interested in starting a telehealth program, they're really the group of folks you want to reach out to first. And because we are federally funded, most of our services are free. But you can actually reach out to any telehealth resource center because we work very closely and collaboratively together. So when you reach out to one, I like to say you're getting all 14 of us. And if you have a question regarding telehealth and that resource center can't answer it, they will tap the other 13, and usually somebody does have an answer, or somebody will go out and find the answer for you. I mentioned the 50-state analysis that we do. This is a snapshot of our website. We put all that information up on our website, as well as making it available in a PDF report. Actually, we were in the middle of doing our first yearly update. We do 2 updates a year, one in the spring and the fall for this information. We were in the middle of our spring update when COVID-19 hit, but that information has now been released. So if you go to our map, you'll find that the information there is good through February 2020. We do have separated out on our website the COVID information simply because that information is temporary. The information in our report is a more permanent state of telehealth policy for each of the states and their Medicaid programs. So the way existing telehealth policy is structured pre-COVID-19, and where you've seen a lot of changes happening because it's in reaction to what was already there on the books, is a lot of it is around reimbursement. And a lot of those policies can be separated out into different factors of like how they do a reimbursement policy. And the factors they look at and how they shape the telehealth policies on the books is in regards to location of where the patient is, the modality that they'll allow to be used and get reimbursed for, the types of services that they'll reimburse, and the type of providers providing those services. So those are the 4 factors to a lot of the telehealth reimbursement policies that are on the books. And you've seen that that's where they've done a lot of the waivers in. So for example, with CMS, you saw them like relieving or waiving the geographical limitations. So that's where you'll see how a lot of the telehealth reimbursement policies, both on the federal and state level, shaped, and also how private payers look at it too. This is an overview, a very, very, very high level overview of some of the areas in which we've seen changes regarding telehealth policy in reaction to COVID, both on the federal and the state level. And again, you see the common areas in which a lot of the changes are evolving, and it's like modality, location, the types of services, and the type of providers who offer those services. You also see other things in which have been addressed, such as licensing, prescribing, HIPAA, consent requirements, etc. So the question that a lot of people have on their minds, though, is that, at some point, because these are temporary waivers, what's going to happen when the public health emergency is over? Are we going to revert back to the pre-COVID-19 landscape of telehealth policy, or are some of these changes going to stick around? Now, I don't have any inside information saying like, yes, I've heard that they're going to keep this around. This is just my best guess. So I'll preface my following comments with that. This is just my best guess of what I think will stick around and what likely will may not be staying around in its current form, but maybe the discussion will be opened up into addressing it once we get past COVID-19. So what's likely to stick around, or we see some sort of version of it? Some of the reimbursement changes. And again, going back to like those 4 factors of what make up a lot of the telehealth reimbursement policy. I think what we'll see is that we'll probably keep the expansion of the originating site, specifically allowing it to be in the home. Once we get through the initial public health emergency, we're still going to have like a change in how we live and how we conduct business and how we receive our health care. There's still going to be vulnerable populations that until there's some protection, like further protection, like a vaccine against COVID-19, you're going to still have vulnerable populations sheltering in place or like not going out as frequently in order to avoid infection. So I think that the home will be kept around as an eligible site for receiving services. Now, what those services might be more limited than what they are now during this public health emergency. So we may see it to, you'll just be able to provide these set of services when you're in the home, but I think definitely we'll see it be more expansive than what we had in pre-COVID-19. Expanding the list of eligible providers. So during this time of COVID, we've seen more providers who are not really on the list of providers eligible to provide services via telehealth in like a Medicare or Medicaid program, has seen them allowed to be using telehealth to provide services, such as your allied health professionals, such as OTs and PTs, speech pathologists. I think that's going to stay in some form, either on the federal or state level or both. So expanding the list of eligible providers. And then expanding the list of eligible services. One reason I think this is going to stick around, again, because you are trying to provide more services, I think, through technology, and especially if you're looking at the home and the different types of providers and expanding those 2 areas, you're going to have to expand the list of eligible services. Also, that is probably the easiest thing that CMS can do administratively in Medicare without requiring a law change. So CMS has a lot of leeway in what services they can put on that list of eligible services to be provided via telehealth and being reimbursed by Medicare. That does not require a law change. For them to expand the home and to expand the list of providers, that actually does require a federal law change. Right now, they have it in a temporary power to do that, but they would need a more permanent change in federal law to be able to do that. However, for expanding the list of eligible services, they don't need that. What was only required of CMS was figure out a process and how you would like add to that list of eligible services. So I think that's like an easy thing for CMS to do administratively. It's probably an easy thing as well for a lot of Medicaid programs. Here are a couple of things that aren't necessarily policy changes that we've seen during this waiver time that I think will be things that are hot topics of discussion going forward once we get past the initial emergency, and that's going to be an increased discussion on training and workforce development. So right now there was some spotty training, like some medical schools had it in a curriculum to include like a telehealth element to it. A lot of them did not, but we're probably going to see more discussion of like we need to increase training and workforce development and using technologies and providing health services. That I think will be like a hot topic of discussion, a lot more resources probably being put in that way, which is only logical. Like so much of our world, our lives are moving to the digital type of application. So healthcare services was just another thing that eventually would be moved on there. COVID just seems to have accelerated the discussion. Expanded deployment and use of the technology, again, going back to, needing to train the workforce, we're just going to use more of this. And I think we'll see more of it in other aspects that we hadn't considered the use of technology for. We've been focused so much on receiving healthcare service, but I think we're going to see that in other places as well that touch upon like social services and touch upon healthcare, but we may not have been sort of like a logical type of connection for a lot of people. For example, even pre-COVID, there was use of telehealth in the justice world, in the criminal justice world, such as using telehealth to perform sexual assault victims examinations, using more of it that for like these other areas that again probably weren't in maybe their narrow focus of like healthcare, but has like a health aspect to it, but also it plays in like another world such as criminal justice, or even like a type of health sector in which it was not regularly used or extensively used. We've gotten through CCHP, we've gotten a lot of interest and questions from college-based health centers where they've had to send like their students home, but still there was like need for the services that they were getting at their student health centers, but running into issues such as licensing, because now the students were back at their home state, but that provider who was at the college did not have a license that state. How do you continue that service? So, greater deployment and use of the technology than what we had seen pre-COVID-19. And I think there'll be greater attention paid to the consumer and the end user, not only in the technology that's being developed, but also, is it going to work for somebody in X situation? Like going back to your college student situation, it's like, how do you make it work when you do have a situation where, college campuses are closed down and then the student has to go back home, but they're still receiving care or need care from like that college-based student center. So we're going to see like, looking at it also from like the patient end of like, is this working? Does the policy here work for the consumer, the patient as well? There are going to be questions that are going to need to be resolved that I think have been raised to like a higher level because of COVID-19. They've always been questions that have been out there pre-COVID-19 that there's been discussions of, but I think now they're really going to have more of like a light shined on them because they have been issues that we've run into during COVID-19 that they've tried to address in a temporary way, and maybe policymakers might be looking for a more permanent fix once we get past the initial emergency. So some of them that I think will come up is the privacy HIPAA requirements. So during COVID-19, we saw temporary waivers or rather with Office of Civil Rights saying like, we're basically not going to fine you during COVID if you were a little lax around the HIPAA requirements. I don't think that relaxation will stay once we get out of the emergency, but the question does arise of like whether there will be like a more thorough discussion of maybe we need to update HIPAA and some of these privacy laws to take into consideration telehealth these days. Licensure, hot topic. Again, going back to like my college student example there, I think licensure will be something that, in the past, it's always been a hot topic, but I don't know if it's captured a lot of policymakers, attention. I think now it probably has. It's been like elevated with COVID-19 that can be a significant issue, especially when you're dealing with a pandemic. Connectivity and broadband, again, always been a hot issue before COVID-19, but I think it's going to be like take on more urgency now, especially if we want telehealth to stick around. Policymakers are going to look at that and say, how do you solve that issue? And going hand in hand with that is the digital divide. One reason during this emergency situation here why they allow telephone to be used is because not everybody has access to technology or have that connectivity to utilize the technology. You have a digital divide there. So how do you address that issue for those populations that are affected by that? And it may not necessarily mean there may be people who have great connectivity but maybe don't have the equipment, or have the equipment, don't have the connectivity, or they have both, but for whatever reason, they're not able to utilize the technology in some way. As a very sort of real world example, my mother is a senior. She has multiple healthcare needs. During COVID, they've been transitioning her for her regular visits into like a video visit. she would not be able to navigate that or do those without my assistance doing that. So you have, like, populations maybe who are elderly who may have issues as well. And I put this as sort of like a separate thing because I'm not quite sure, but I can see this happening as possibly increasing the pressure on health plans to cover more telehealth in a post-COVID world. Um, Having them, there are right now telehealth private payer laws on the state level in about 43 states at this point, but they do range in like what they require the health plans to do and what they require them to cover. And I can see that being a little more explicit in what policymakers are expecting, what states are expecting, and maybe what we might even see pressure on the federal level, maybe for like Medicare Advantage plans, a little bit more explicit direction of like how they deal with telehealth. So I can see that occurring as well in a post-COVID-19 world. So just a few things I wanted to make folks aware of. This is a new California consumer telehealth website that just launched 2 nights ago. It has information, basic information on telehealth, but also information for the consumers on where they can find more information, a nurse advice line, and also a way for people to just type in their zip code and it'll bring up what health plans in their areas are covering telehealth and take you to that health plan's website for further explanation of what they have available. This is one of those examples where I think more attention is going to be paid to the end user, the consumer, in regards to telehealth. This was actually done by a state government here, and I think we'll probably see more of that out there. This is the HHS telehealth website, so a federal website where, again, there's a section there directed at the consumer, the patients, in regards to telehealth. More information to that consumer patient. Population, giving them information on telehealth. Again, I think we'll see more of that, not only in the federal level, but individual state levels as well. And just some links for you to some CCHP resources and our URL and our information email if you have any questions. I hope you found this useful, and I hope everybody is staying safe, and we'll see you on our next video. Thank you.